Hello everyone. So today in this lecture we will discuss about the estimation of age by radiological examination part 3, that is from 13 to 17 years. Okay. Now for age estimation up to 13 to 17 years, the following x-rays are considered. First is the elbow joint, the second is the wrist joint, and the third is the pelvis joint or hip joint. The elbow joint, at the age of 16, all epiphyses of elbow joints are fused. That is, upper end of radius and ulna are fused with the lower end of humerus. See, this is the humerus bone, this is the ulna bone, and this is the radius bone. Now, you can see all these joints in a elbow joint. Okay, and this is another X-ray of elbow joint. Do you see any difference between both of these X-rays? See, there is a very thin line present between the medial epicondyle and the humerus bone, and there is no such line in there. And there is also a thin line at the radial head, which is not present here. So, this elbow joint is fused, but this is not fused. This fusion occurs at the age of 16. Now, look at the wrist joint. We have to look for the base of first metacarpal in the wrist joint. The base of first metacarpal, it fuses at the age of 15 years. See, this is an X-ray of wrist joint. This is an X-ray of wrist joint. This is the radius bone. This is the ulna bone. These are the carpal bones. And these are the metacarpal. First, second, third, fourth and fifth metacarpal. Do you see a very notch and a very thin line between at the base of first metacarpal bone? Okay. Now compare it with the second X-ray. This is the radius bone. This is the ulna bone. These are the carpal bones. And this is the first metacarpal. Do you see any difference between the base of first metacarpal in the first X-ray and the second X-ray? Yes, definitely. So there is this metacarpal, base of first metacarpal is not fused, but this is fused. So the second X-ray is greater than the age of 15 years, but the first X-ray is less than the age of 15 years. Now, what to look in the X-ray of pelvis? The X-ray of pelvis, you have to look for the iliac crest. A very thin line above the ilium is called as iliac crest, and the ischial tuberosity. Okay. The other thing you have to note is this area. This area is called as triradiate cartilage. Okay. And also look at the lesser trochanter of femur, a very thin one at the femur bone. This is the lesser trochanter of femur. In this slide, we will compare the three X-rays of pelvis joint. Okay. The first X-ray. This is the first X-ray. This is the second X-ray. This is the third X-ray. Look very keenly on the various changes in these X-rays. Okay. Now, in the first X-ray, the iliac crest has not appeared. Okay, see clearly the iliac crest has not appeared. In the second X-ray, the iliac crest has appeared. This is a very thin line above the ilium. And in the third X-ray, the iliac crest has appeared and fused with the ilium bone. Now, the second difference is that ischial tuberosity. Ischial tuberosity has not appeared in this X-ray, and in the second X-ray, ischial tuberosity, in the form of a very thin line, it has appeared. And in the third X-ray, the ischial tuberosity has fused with the ischium bone. And the third difference is the triradiate cartilage. The triradiate cartilage has not appeared in the first X-ray, but in the second X-ray and the third X-ray, the triradiate cartilage are fused. So the first X-ray is less than the age of 14 years because the iliac crest has not appeared. Iliac crest, it appears at the age of 14 years. The second X-ray is greater than 16 years because at 14 the iliac crest appears and at 16 the ischial tuberosity appears. And the third X-ray is greater than age of 20 to 21 years because the iliac crest and ischial tuberosity, they both fuses with their respective bones at the age of 20 to 21 years. Now, important points to remember are, at 13 years, separate centers appear in triradiate cartilage of acetabulum. At the age of 12 to 14 years, lesser trochanter of femur appears. At 14th year, crest of ilium appears. At 15th year, fusion of triradiate cartilage of acetabulum occurs. and at the 16th year, ischial tuberosity it appears.